And in January, the cause was identified to be a new coronavirus or novel coronavirus. By the end of January, there were over 9,000 cases globally. We, in the U.S., initiated airport screening. And in the U.S., the first case of novel coronavirus was detected on January 21st in Washington State. Arizona confirmed our first case on January 26th. This was in an adult living in Maricopa County with recent travel to Wuhan, China. Maricopa County Department of Public Health, ADHS, and CDC have coordinated this local response. We currently all work on case contact identification, PUI classification, and we arrange testing with CDC. And in February, most recently, the WHO officially named the new disease as COVID-19. And by the end of February, there were over 51 countries with cases and over 80,000 cases were identified. The U.S. Identified our first possible community spread of COVID-19, unfortunately. This is just a map of, from the WHO of the distribution of COVID-19 cases as of February 28th. You can see that the infection started in China and it has spread globally since then. And now I'll be talking a little bit more about COVID-19, the disease, and the virus. The virus was named SARS-CoV-2, and that is what causes COVID-19, the disease. We thought it was important to emphasize that coronaviruses are a large family of viruses. There are several known coronaviruses that infect people and usually only causes mild respiratory symptoms, and usually these are, this is what's referred to as the common cold. Coronaviruses can also be found in animals, and some of these viruses have the capability of transmitting between animals and humans or from person to person. And what we know about COVID-19 is that patients with COVID-19 have a wide range of symptoms from very mild and can be severe. These symptoms can include fever, cough, and difficulty breathing. Certain people are at higher risk of severe disease, like elderly or those with underlying chronic medical conditions. A report from China suggests serious illness occurs in about 16% of cases, although so far the information suggests that those with COVID-19 experience very, very mild illness. And like I said, those that are of older age and those with underlying health conditions may be more likely to develop serious outcomes versus healthier people. And the virus is thought to spread from person to person via respiratory droplets that are produced when someone who is infected may cough or may sneeze, and they can spread that disease. There is currently no available medication to treat or a vaccine to prevent COVID-19, although those are under development currently. And we thought it was really important to mention that, you know, your best prevention measures right now that you can take are using proper hand washing, washing your hands for at least 20 seconds with open water, covering your coughs and sneezes, and staying home when you are sick. We also wanted to cover a little bit about public health strategy and how we initially started and where we are now. So we started with trying to contain the virus at the source. Now with some community spread, we are working towards community mitigation and preparedness strategies. So in the early stages of an outbreak like COVID-19, public health takes measures to contain diseases to stop them from spreading in our communities. and this is called containment. And for example, in Arizona, local public health partners have been monitoring travelers returning from China for symptoms of COVID-19 and ensuring that individuals suspected of being infected were isolated until their test results came back negative. Given national updates, it's become clear that there is a higher likelihood of community spread within the U.S., and public health measures begin to shift to slow the spread of the virus rather than to contain it at the source. So for example, as additional community cases are identified, it may no longer be feasible to isolate infected individuals and quarantine their contacts. Instead, public health may begin working with community and business leaders to encourage social distancing. So what can you do? We would like you to stay informed about the local COVID-19 situation, find reputable sources. Thank you for joining this webinar. Don't spread inaccurate information. Public health agencies are sources that will provide factual, up-to-date information. You can always visit our ADHS website. The CDC website is a great resource. Contact your local health department for the most up-to-date news about what is happening in our community with COVID-19. Please review your infection prevention and control policies at this time. Make sure those are, you know what they are, where to find them. Develop or review your facility's emergency plan. A COVID-19 outbreak can lead to staff absenteeism. Prepare alternative staffing plans now to ensure staff availability. Planning for absenteeism could include extending hours, cross-training current employees, or perhaps even hiring temporary employees. And you should communicate with your staff. You should let them know, what is the most current information about COVID-19. That you may need to do a potential search of your staff. Tell them about your preparedness plans for your facility. And go over your sick leave policies with them and whether those may need to be changed. And communicate with your patients. Describe what actions you are doing to protect them. Explain what they can do to protect themselves and their fellow residents. Provide updates about changes in policies that would affect them and about any visitation policies and any changes that may need to occur. So I wanted to go over some strategies to prevent the spread of COVID-19. These are the same strategies that you all use every day to detect and prevent the spread of other respiratory infections like the flu. So this should not be new to all of you. This should be very familiar, but we did want to emphasize that point. So one of the three prongs of this is to prevent the introduction of respiratory germs into your facility. So some of the ways that you can do that is by limiting visitors to your facility. You can post signs at the entrance instructing visitors not to visit if they have symptoms of a respiratory infection. You can observe newly arriving patients or residents for development of respiratory symptoms, implement appropriate infection prevention practices for incoming symptomatic residents, and ensure that sick leave policies allow employees to stay home if they have symptoms of respiratory infection and are non-punitive. The second prong is to prevent the spread of respiratory germs within your facility. So monitor residents and employees for fever or respiratory symptoms. Tell them to report to you if they develop any of those symptoms. Limit the movement of patients with respiratory symptoms or with fever. Use standard contact and droplet precautions for care of residents with COVID-19 or undiagnosed respiratory infection. Support hand and respiratory hygiene, as well as cough etiquette by residents, visitors, and employees. Post visual alerts, signs and posters and entrances, and in strategic areas around your facility. Provide instruction on proper hand hygiene, respiratory hygiene, and cough etiquette. Ensure that supplies are available for people to use and are stocked. And provide the right supplies to ensure easy and correct use of PPE. Post signs on the door or wall outside of the resident room that clearly describe the type of precautions needed and required PPE. Make PPE available immediately outside of the resident room, such as face masks, eye protection, gowns, and gloves. Position a trash can near the exit inside any resident room to make it easy for the provider to discard PPE. And you may want to also identify dedicated staff to provide and care for COVID-19 patients or just patients with respiratory infections in general. So this is not anything new. We're just reviewing similar strategies to prevent respiratory infections from spreading within your facilities. We also want to be cognizant of preventing the spread of respiratory germs between facilities as a containment measure. Notify facilities prior to transferring a resident with an acute respiratory illness, including suspected or confirmed COVID-19. Report any possible COVID-19 illness in residents and employees to the local health department. And then a little bit about infection control. The recommended infection control standard and transmission precautions are standard contact and droplet precautions for COVID-19. Hand hygiene is very important, like we already went over. And the proper PPE is gloves, gown, a medical mask, and eye protection. And that can be a face shield or goggles. And for aerosol generating procedures, we do recommend the use of, for healthcare workers, the use of gowns, gloves, respirators, such as an N95 mask, and eye protection. And then generally, to take precautions for infection control, you should manage your visitor access and movement within the facility, establish procedures for monitoring, managing, and training visitors, restrict visitors from entering the room of known or suspected COVID-19 patients. Visitors to patients with known or suspected COVID-19 should be scheduled and controlled. And all visitors should follow respiratory hygiene and cough etiquette precautions while in the common areas of the facility. You should also monitor and manage your ill and exposed healthcare personnel. Movement and monitoring decisions for healthcare personnel with exposure to COVID-19 should be made in consultation with public health authorities. That would be your local public health department. And facilities and organizations providing healthcare should implement sick leave policies for healthcare providers that are non-punitive, flexible, and consistent with public health guidance. And you all know this, provide healthcare providers with job or task-specific education and training on preventing transmission of infectious agents and proper PPE usage. And you may want to dedicate certain medical equipment to be used for patient care. You all do this on a daily basis for multi-drug resistant organisms. The same could be done for patients with COVID-19 or other respiratory infections. And all that non-dedicated, non-disposable medical equipment used for patient care should be cleaned and disinfected according to the manufacturer's instructions and your facility's policies. and ensure that environmental cleaning and disinfection procedures are followed correctly each and every time. And bleach and water is known to kill SARS-CoV-2, as well as a lot of other pathogens. As far as specific cleaners or specific disinfectants, we recommend using an EPA-registered hospital-grade disinfectant that has an emerging pathogens label on it. If that is not available to you, then we recommend that you use one that has labels indicating effectiveness against human coronaviruses. And here are some additional resources for you all. And I think that's pretty much all I got.
Thank you, Liz. What we'll do now is we'll go ahead and go to the question and answer session. So if you do have a question, we ask that you enter it into the chat box so that we can see it, and we'll respond to as many as we can within the time that we have. Thank you.
We have a question with regard, should a long-term care facility limit visitors? I think it is practice that during these periods of high flu, or in this case, potential community exposure, that the facility should look at their emergency preparedness plans. And as they look at those plans with regard to transmission, it may be that your plan does initiate a limitation on visitors, and you would implement what is in that emergency preparedness plan.
There is a question, who do we contact if we have a suspected case for testing? And so we would want you to work with your local county health department, let them know about this possible patient or resident, and that way they can go ahead and help you through that process to decide if that individual requires testing.
We have another question that says, how long is testing taking for results to arrive? Test results are typically arriving within a day or so from our state public health laboratory. And there's another question that says, once we have a confirmed case in the facility, will we continue to test or assume all other symptomatic cases are COVID-19? I think that would depend on the local health department or the county health department, the boots on the ground. They'll be the ones leading those investigations, and that will kind of depend on the circumstances, and it will be done on a case-by-case basis. But there might be additional testing requested once you've identified a single individual positive.
There's a question about recommendations for isolation and what we are recommending. So currently it's contact droplet and eye protection. So the one kind of addition beyond what you would routinely use for other respiratory viruses would be that addition of eye protection, which could either be a face shield or goggles.
Another question on any advice and procedures to recommend for a resident or staff member or to have a suspected case of COVID-19. If there is anyone who's suspected to have COVID-19, you should really contact your local health department to talk about potential for testing and evaluation.
There's a question about what type of masks to use. So the current recommendations are to use a standard medical or surgical face mask. An N95 respirator is only required for aerosol generating procedures. So generally, I don't think you would be performing those types of procedures in long-term care. But if there's any question, that's the the general recommendations for medical face masks. The question about whether or not presumptive positives need to go into negative pressure. So again, there is some recent change in guidance from the Arizona Department of Health Services that only requires droplet isolation for patients. So they would not need to be placed in an airborne isolation room or negative pressure room.
We received a question concerning whether or not lab tests will be available to the labs that are providing services to long-term care facilities or assisted living facilities. At this time, testing is available through the CDC and through our state public health lab. Here at Arizona Department of Health Services, several commercial labs are working on testing, and we suspect that that'll be online within the next couple of weeks, and then there will be some availability for those other sources.
Another question is, in the event a direct care staff or resident in an ICF are diagnosed with virus, would that entire ICF be closed and residents move to other facilities? That would totally be dependent on your local health department and what they recommend, but probably not.
We have a question here. If we have staff on a cruise at this time, what should we be doing when they get back? Should they be off for 2 weeks? We would ask that if they had any recommendations given to them by public health while they were on the cruise, that they adhere to those. And if anybody is planning travel, we would ask you to look at the CDC's website that has travel updates and warnings so that you can be aware whether or not you're going to an area that has spread of coronavirus.
There was a question with regard to PPE. Earlier in the slides, there was direction on the use of PPE, and that recommendation is and continues to be consistent for healthcare institutions.
We have a question with limited and backordered PPE supplies, any recommendations? What we would recommend at this time would be to work with your local health department to let them know if you're having any constraints or issues with obtaining PPE. And I'll hand it over to our Teresa with Beth to see if she has any additional recommendations.
There is a spreadsheet that has been shared with all county health departments that allowed healthcare institutions to put in any quantities and type of PPE that they had on hand that they would be willing to work with another facility on. I'll just say sharing, but the agreement between the two health facilities would be, you know, whatever they arrange, whether it's on loan until that other facility's product comes in or they, you know, sell it to them. Whatever that agreement is would be between the two healthcare facilities. But it has worked. There was a long-term care facility, a nursing home in the western part of the state that was able to get product that was put out on that spreadsheet. So the health department, ADHS cannot purchase anything right now on behalf of a facility, and we do not have a stockpile, excuse me, coming in. But local health should be able to help in those situations.
There's a question about exposed staff but not symptomatic, and they continue to care for residents in a cohorted fashion. So again, that's another local health department investigation, case-by-case determination, and doing risk assessments for those individuals and what their exposure was and if they were wearing proper PPE or not.
Here's a question concerning if organizations provide pet therapy and have volunteers. Are there any specific guidance or recommendations? We would recommend that you adhere to your normal policies and protocols, and also to review your preparedness planning to see how this is addressed. And that way you can have a plan of action moving forward and deciding on any next steps are needed. Kathy or Diane, I don't know if you have anything to add to that.
That is correct. In this situation, as with any and all events, unusual incidents and events that happen in our healthcare institution, we really do look at your emergency preparedness plan that is written and tested to be able to respond to some of these situations that we are dealing with, sometimes on an annual, if not more often basis. So we would encourage you to look at that emergency plan, put into place those actions that will allow you to continue to provide the best and safest care to your residents.
Questions about cases in Arizona, and there are 2 cases in Maricopa County, and we do have information on pending cases and those case counts posted on our website.
There's a question that was posted. Do you recommend testing the self-isolation of employees who have traveled to a known outbreak area? So for this, we would definitely recommend, if they were contacted by any public health authority, for them to adhere to those recommendations. But it really comes down to, it's not only the travel, but whether or not they are experiencing symptoms. And then we would recommend at any time you had that scenario and situation that they would go ahead and contact their healthcare provider to be assessed and take appropriate next steps. You can contact the local county health department to decide if any next steps are needed.
I'd like to take this opportunity to also remind long-term care certified Medicare providers that there were several documents released on behalf of Medicare yesterday. One of those documents did deal with guidance for infection control and prevention for in nursing homes. And with that document, there is some guidance that they have referenced in addition to utilizing the current infection prevention control and immunization pathway that is used through the recertification process as a tool to help you be prepared and to identify any gaps in your current system so that you can mitigate those as quickly as possible using infection control practitioners or your medical directors.
We're hearing a little feedback on the phone. If you could please remember to mute your lines and your computer mics.
We've gotten questions on people returning from affected areas. So on CC Travel website, they do have guidance for individuals who left areas where there is widespread ongoing community spread, and their recommendation is really to practice that social distancing. So they do recommend that individuals stay at home and avoid contact with others for that 14-day period.
Okay, since it seems like we've come to a point where we've answered the majority of those questions, we'd like to thank everybody for joining the webinar. We hope that everyone has a great day, and thanks for your participation.